Hi, my name is Tim Howell. As an athlete trainer, a lot of the athletes I treat either have an acute or a chronic injury, so something that they've had for a while or something that they absolutely just sustained. The best examples I can give you are probably from the SLU Club ice hockey team. So in hockey, a lot of the injuries that are sustained by athletes tend to be upper body injuries. If an athlete gets checked in the boards pretty hard, sometimes they can actually sustain an injury to their shoulder, or the shoulder actually comes out of its joint, reduces itself instantaneously. Well, a lot of times in those situations, we can have the athlete do some rehab and get some strength back into that joint and be able to return. Other times you actually have a shoulder that'll dislocate, meaning it won't actually reduce right away, and that's going to be something that's going to be more of a chronic type of condition that sometimes requires surgical intervention to repair. The most important piece of any evaluation or anything else beyond having a great relationship with your players is that you really seek their participation in the process. And a lot of times when there's an injury, I need to get a great history from our athletes to find out what their signs and symptoms are, kind of how they're feeling, because that's really going to give us the baseline for our next steps. Depending on what the findings are clinically, we might have to refer them on to someone else, and so what that means, we have to incorporate more people into the treatment plan, therefore that'll give them more treatment options. As we look at those options, we have to make sure that we assess what are the values of the patient, what are the things that they need in terms of how quick they need to get back, or if it's something that it requires some long-term rehab and therefore it won't come back as quickly as otherwise indicated. If the joint's pretty swollen, well, there are some ways you can actually take care of that. Apply compression to it, you can apply ice and compression, Advil, Aleve, ibuprofen. There's a lot of different interventions. Some people, they're allergic to ice, so therefore they can't ice. Some people are really sensitive to NSAIDs, but a lot of times depending on the patient's preference, they can determine the best way for them to manage the swelling of the inflammation. Once we've actually assessed a lot of those things, I can work with the athlete to reach a decision about which modalities they want to use and kind of what their progression should be. I think it's important to look at short and long-term goals. The short-term goals are things that we can look at subjectively and objectively so that they can get better. Long-term goals are ultimately returning to play. And after we're done with that whole scenario, we're going to reevaluate the athlete, but also reevaluate the process. Really, if you think about the SHARE approach, seeking the participation, helping, assessing, reaching, and evaluating, when you have good rapport with the people you treat, they have a better sense of that you care about them, and I don't really care what you know, and your patients don't care what you know until they know that you care.